Post-traumatic stress disorder has long been associated with veterans of war, but the truth is, this condition is prevalent worldwide. Traumatic experiences can change the brain and the central nervous system, producing these changes that can last a lifetime. Many women, children, and adolescents suffer from post-traumatic stress disorder. The good news is there are new medical breakthroughs that can help with this disorder. They've even retermed the terminology for post-traumatic stress disorder, calling it post-traumatic stress injury. Psychotherapy has long been the treatment of choice, but stellate ganglion block shows great promise. First, let's think about who gets PTSD and the reasons why. Of course, veterans of war have recurring flashbacks of violent images that they've seen. They can be plagued with nightmares, anxiety, and panic attacks. But other victims also suffer from PTSD. Victims of crime, rape, muggings, kidnappings, etc., and even witnesses of crime. If they particularly have witnessed a murder, they may develop PTSD. People in abusive relationships often get PTSD, and this is a result not only of the trauma, but the fact that the trauma is recurrent and there's a prolonged traumatic entrapment, and they see no chance of escape, which can lead to hopelessness and increased suicidal ideation. Children also are victims of abuse and neglect, and they too can develop PTSD. The problem with PTSD in children is it's much harder to diagnose. So they're developing a new protocol to diagnose PTSD and PTSI in children. The frontal lobe and the temporal lobes of the brain, the structure of this has changed when children are traumatized. So these difficulties and impairments can really be lifelong if they're not treated adequately. Now that we understand what PTSD and who suffers from it, let's take a look at some of the treatments. As I said, psychotherapy is one of the main treatments that has been traditionally used for PTSD. And of these, trauma-focused cognitive behavior therapy is the treatment of choice. It's an evidence-based practice. The problem is there aren't enough qualified providers to provide this treatment to all the people that need it. Other psychotherapeutic treatments that are used are imagery rescripting and also eye motion desensitizing. The medical community has really taken note now that they realize that PSD is a physiological condition to possibilities of medical treatment for it. One of the best treatments is a stellate ganglion block. Dr. Eugene Liphoff is an expert in the field. He has pioneered many of the treatments. This stellar ganglion block is injected here into the stellar ganglion at the first thoracic ganglion. This blocks the sympathetic nervous system that is producing extra growth for the nerve system. This creates extra neurotransmitters that create adrenaline and norepinephrine in the system. And this is one of the big reasons that anxiety is such a problem with post-traumatic stress disorder. With this block, they've had tremendous success. Sometimes one shot will last for years and years. What they are trying to do is reverse the damage done to the nervous system by post-traumatic stress disorder. There are other treatments the neuroscience is really beginning to investigate, the way the brain works and the things that we can do to correct the damage done by trauma in our lives. Now that we see the kinds of people that suffer from PTSD, the prevalence of it, and the devastating effects, we realize that there's a great need for research to help these people suffering with this illness. Fortunately, these medical breakthroughs are showing a great deal of promise, and there are many new hopes hopes on the horizons for people suffering from PTSD.